Hello, my name is Katie Deputy, and today I will be talking about the symptoms, causes, and treatment for depression.
I'm Ariel Deputy, and I'm 21 years old.
I'm Nick Pruitt, and I'm 19 years old.
After hearing my speech, the audience will know more about the symptoms of depression. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest while affecting how you feel, think, and behave. According to the World Health Organization, about 280 million people worldwide live with depression, an estimated 3.8% of the population. Depression is different from regular mood changes and feelings about everyday life. It can affect all aspects of life, including relationships with family, friends, and community. It can result from or lead to problems at school and at work. Depression often begins in teens around our age and results from a complex interaction of social, psychological, and biological factors. People who have gone through adverse life events are more likely to develop depression. Today we will be talking about its symptoms and causes. According to Medical News Today, symptoms of depression include thoughts of death or suicide. A person with depression may think more about death and dying. They may also think about suicide and how they could end their life, which is suicidal ideation. Depression can vary in how intense it feels, so mental health professionals typically categorize it into three types: mild, moderate, or severe. When depression is moderate or severe, it could lead to self-harm, thoughts of suicide, or suicide attempts. Major depressive episode is another symptom of depression. 5 or more depressive symptoms for 2 weeks or more. Must have either depressed mood or loss of interest. Symptoms must cause significant distress or impairment. Minor depressive episode is another symptom. 2 to 4 depressive symptoms for 2 weeks or longer. Must have either depressed mood or loss of interest. Symptoms must cause significant distress or impairment. Sadness is another symptom. Being sad short term and depression are individually different things. Depression requires treatment, and common sadness passes with time. Depression is a long-lasting range of emotions such as a low mood and a lack of energy. Hopelessness is another symptom. Hopelessness is a feeling of despair, a lack of hope, having no expectations of good or success. In depression, hopelessness is a common symptom. This means having negative expectations and clouded judgment, that problems cannot be solved. Many of the symptoms of depression are individually common. There can be many different causes leading to depression, such as stressful events, family history, alcohol and drug usage, trauma, and etc. According to Stanford Medicine, in most cases, around 50% of the cause is genetic. Today we have learned the 5 main symptoms of depression and what causes them. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest while affecting how you feel, think, and behave. If you have all or some of these symptoms, you can reach out and seek help. Antidepressant pills such as Prozac, Zoloft, Paxil, etc. use neurotransmitters to regulate mood and behavior. Therapy can also be effective to treat depression. With proper help, people with depression can get treated and reduce symptoms.